Hello all, this is Dr. Dheeraj Masapu, and many of you are asking me in comments what next after MD Anesthesia. So I thought to do this video about what super specialties are there after MD Anesthesia and which one would suit you as a person. So first I would like to tell my story. You all know that I'm a Neuroanesthesiologist. I give anesthesia for brain surgeries. So how I took up this neuroanesthesia, I would like to tell you. So basically what happens is when you're doing your MD anesthesia training, you work in several departments like cardiac anesthesia, neuroanesthesia, pediatric anesthesia and transplant anesthesia in several areas. So in the process, some areas will excite you. Same thing has happened to me while working in MD Anesthesia. I think significant part of my MD Anesthesia, I worked in Neuro Anesthesia, and I really liked Neuro Anesthesia. And what happened is after that I went to my place, and after finishing my MD, that is a place called Rajahmundry in Andhra Pradesh, where I worked in a hospital where a neurosurgeon is owning the hospital, and in that hospital I was working as an anesthetist. During that time I was taking care of the neurosurgical ICU and also giving anesthesia for some of the cases that he was doing. During that time I got interested in neuroanesthesia, and even the neurosurgeon encouraged me to do further studies in neuroanesthesia. That's how I prepared for NIMHANS examination. That time it was a separate examination. This was in 2013. So 2012 actually I started my preparation. 2013 I joined DM in neuroanesthesia. I got first rank those days. So in my life I chose neuroanesthesia not because neuroanesthesia will have good prospects or money, all these things I didn't think about. In the process I started working more in neuro and got interested in that. So that is how I chose. Why I told this story is basically for you to understand that, see, I'm going to tell you now several specialities after MD anesthesia, but the choice that you're going to make should be based on the interest more than the financial aspect or the work-life balance or whatever it is. So I'm going to also tell you the salary structures and financial aspects at the end of the video. So that is there. So first I would like to talk about neuroanesthesia. So if you really like to do neuroanesthesia, then the best thing would be to do DM in neuroanesthesia. So like how I did in NIMHANS, there are several centers where you can do it, and the best would be NIMHANS, AIMS, PGI, Chandigarh, and JIPMER and SGPGI. And also, if you're not, but very few will get the opportunity to do that. If you're not getting, then you have an equivalent DNB degree also in major corporate hospitals like in Delhi and several places they are there. And that is one way. And the third way of doing neuroanesthesia is doing a fellowship. So even I run a fellowship in neuroanesthesia under the banner of ISNAC, that is Indian Society of Neuroanesthesiology and Critical Care. So if anyone is interested to do fellowship under me, you can apply. My email is there in the description. You can just email me. It's a 1-year program, and you'll be exposed to very complex cases of neurosurgeries and neuro-intensive care management. So that is about neuroanesthesia. Who should take neuroanesthesia? I'll tell you. So basically, neuroanesthesia should be taken by people who have some interest in neurology, neurosurgeries, and neuromonitoring, where a lot of technology comes into the play. And so if you're such kind of a person and you have a lot of attention to detail, then you need to do neuroanesthesia. And the second thing is that in the process of doing neuroanesthesia, you will realize that the working hours are little more. That is one disadvantage of that. Today, I think I worked for nearly 13 to 14 hours. So it is not the duration of hours that we see the result basically. So since neurosurgeries like CP angle surgeries or major meningioma excisions, they take some time, and even the anesthesia to recover also, they take some time, and we are focused mainly on the outcome of the patient rather than looking at the number of hours that we are working. So that is how neuroanesthesia works. And coming to the financial aspect, it would be good, and also is dependent on which center you're working in. Basically, if you're working in an institute like NIMHANS Ames, there's a fixed 7-pay scale, and if you're working in a corporate hospital, it depends on which area it is located, in which part of India it is located. It depends on multiple factors. And also, if you're going to B-type cities, then salary scales will be different. If you want to know more details, I have done a video on salary of anesthesiologists. You can check out in that. And this is about neuroanesthesia. And second thing, the second specialty which I would like to cover is cardiac anesthesia. So cardiac anesthesia also follows a similar kind of pattern. There are DMs available in Bangalore. Jayadeva Hospital is good. Like that, several hospitals are there, and there are also DNBs and fellowships are there. So DM in any specialty will be 3-year period. Even DNB is 3 years. Fellowships are usually 1 year, and some centers are 2 years. Most of the places, diploma in anesthesia people are not eligible for doing DM and DNB programs. So you should have a DNB or an MD Anesthesia degree to qualify for the DM examinations. So who should take cardiac anesthesia is basically, I feel many people think that only it is for adrenaline junkies. It is not true. So what happens is cardiac anesthesia is mainly working with the cardiac surgeons in CABG surgeries and valve replacement surgeries. So in the process of cardiac anesthesia training, you will be exposed to transesophageal echo, and you will be interpreting that during the surgery. And also you will be managing cardiac intensive care. So the third, what next after anesthesia would be, I feel, transplant. Now many people are showing interest in transplant anesthesia. So the reason is that many new transplant centers are coming up, and it is very exciting to work in transplant anesthesia, and it needs a special training. That no doubt about that. So transplant anesthesia, there are DMs available, and there are very good fellowships available in India, in Medanta and other hospitals. You can think about it. So transplant anesthesia anesthesiologists also manage the transplant ICUs, just like how the cardiac and neuroanesthesiologists manage. So the only disadvantage I see in transplant anesthesia is the duration of hours is like pretty longer compared to cardiac and neuroanesthesia, because transplant surgery sometimes take a lot of time. That is one thing, and you will be mastering thromboelastography, blood transfusion management, coagulation parameter management, and you'll be working on those kind of parameters. And there are moments where like massive blood loss will happen, and you'll be mastering the massive blood transfusions, and it's a different field totally. So you'll work with recipient and donor in liver transplants. So that is about the transplant anesthesia. So who should take transplant anesthesia is, I really can't tell you that this kind of people should take it. I think you should work in transplant anesthesia for some time and then take a call if you're really excited about that. So, but only thing is that this cardiac and neuro are there in B-type cities also. The number of centers where cardiac and neuro are happening are more. So getting a job is more easier than transplant, because transplant is happening only in very few centers in India. So you need to stick on to a particular center in a metro cities. So that is where the transplants usually are happening now. Maybe things might change in the upcoming future. So in 5 to 10 years, maybe many centers will do a lot of transplants in future. So that is about the transplant anesthesia. So next specialty I would like to talk about is the pediatric anesthesia. So pediatric anesthesia, actually even I thought I would do pediatric anesthesia after finishing my MD anesthesia, because I was not very confident in doing pediatric cases. Doing a pediatric case is totally different compared to general anesthesia cases. You need to understand the pediatric physiology, and the extreme level of safety should be there during the anesthesia. So I feel everyone, if you really want to start your private practice, then I would suggest maybe 6 months or 1 year you work in a pediatric center. In Bangalore, there is one center called Indira Gandhi that is very good, and Amrita is also very good. So that is about pediatric anesthesia. So you can go into the NMC website and check out several DMs in different specialties. So these are the DMs which will come. Onco anesthesia also DM is coming up, and not coming up, it is already there. And onco anesthesia basically deals with major oncological surgery, head and neck onco surgery, airway surgeries, and major gastrointestinal onco surgeries, and except neuro, where it is dealt by neuro anesthetists, rest of the surgeries are dealt by onco anesthesia. So who should take the onco anesthesia? What I can tell you is, so basically if you want to try out something new, see, there are many people in cardiac, neuro, transplant. Onco anesthesia, I think very few people are there. So if you want to try out something new, then onco anesthesia would be a good option. So because very few anesthesiologists who have done DM are there in India. So in future, I am looking at a lot of demand coming up for onco anesthesiologists. Nowadays, I'm seeing a lot of hospitals are setting up the radiation units, and even proton beam therapies are coming up. So I'm looking at a lot of new centers coming up with onco background. So a lot of onco anesthetists would be required. There are two reasons. One is not only for anesthesia, onco intensive care is totally different ball game. So they'll be trained in both anesthesia and intensive care. So that's like a double-edged weapon. So onco anesthesia also would be a very good what next after the MD anesthesia. And next would be obstetrics and labor analgesia. So obstetric anesthesia is also, there is no DM in that, but many people do fellowships in obstetric anesthesia. And so there are some fellowships where they combine obstetrics and pediatric, and those kind of fellowships are also there. You can think about that kind of fellowship also. So obstetric anesthesia, in the process of training, you will be exposed to a lot of high risk pregnancies, and also there you will know how to deal the labor analgesia, how to conduct labor analgesia perfectly. So that is a different ball game totally. I personally, I'm a neuroanesthesiologist, I told you. So I don't have much experience in that field. So you need a special person to do that. So that doing fellowship would help you, and going into centers like Rainbow, Motherhood, and so many exclusive centers are there now. So they would hire such kind of people. So a very, very good job opportunity would be there, because the number of centers would be more. Like opposite to the transplant anesthesia, where the number of centers would be lesser, for obstetric anesthesia, the number of centers would be more. So getting a job would be easier. And critical care medicine, I don't want to cover in this particular thing, but little bit I will tell you. Many anesthesiologists I am looking at nowadays post-COVID are going into critical care medicine, and they're actually, what's happening now is even the general medicine guys are also entering into critical care medicine. So you need to compete with general medicine people in managing the intensive care units. So, but any day anesthesiologist will have an edge in airway management, ventilator management, percutaneous tracheostomies, intubations and all that. But general physicians are very good in diagnosing, which is a critical element in intensive care management. So that is a different ball game. If you're interested in doing intensive care medicine, then I would suggest you to go for DM. Don't think about any fellowship, because there is a reason for that, I'll tell you. Because critical care medicine is a totally new subject. Till now, whatever I spoke has some part of anesthesia related to that. So even if you do a fellowship, you can somehow manage the show. But critical care medicine is totally, you're more like a physician and anesthesiologist combination. So I feel you need to undergo rigorous training in critical care medicine. I feel a minimum of 3-year training at the DM or equivalent DNB would be required. So if you're planning to do more research and try to be more academic, then DM would be a good option. If you want to work in corporate hospitals, then DNB is equivalent to DM. So that is about the critical care medicine. Who should take up critical care medicine? Again, don't decide by the salaries or by the this thing. You should have interest in that. You try to work in critical care for at least 1-2 months in your MD, and after that try to work. If you really get excited, then you take up. There is regional anesthesia also, the nerve blocks that we give in performing orthopedic surgeries. See, the nerve blocks are there are like several nerves in the body. You can block and perform the surgeries. So those fellowships also are there. So that needs to be done in a very good center. I would recommend Ganga Hospital for that in Coimbatore, and it's a very good center. There is a 6-month fellowship. I think 6 month or 1 year fellowship is there. That is a very good fellowship. You can try to get into that fellowship, and after that you can do your general practice, and you'll be linked more with orthopedic surgeons, and you'll be giving more nerve blocks and everything. So that is about this one. And the last I would like to discuss is pain medicine. Many people are requesting me to talk about pain medicine also. See, to training, you can get trained. There are fellowships in India, abroad, and several places are there. So you need to set up your own clinic, either in a corporate hospital, or you need to set up a separate clinic separately, and you need to treat patients. But giving the blocks and all, you need to have attached hospital, because you need some kind of backup center where if any emergency happens, you need to have a backup plan, so that you need to do it in a good institute if you're doing a nerve block. But pain practice can be done in a clinic outside. So what I'm trying to tell you is pain medicine can be pain medicine is the only speciality of anesthesia where you can set up your own clinic. If you want to be a physician, if you want to have your own clinic and run your own OPD, then pain is the only option that you have. Exposed to public, and then if you want to have your own clinic outside, you want to run your own OPD business, then pain would be a good option. And some comments are coming to me inquiring about how the pain will be in B-type cities. See, pain will be very good in B-type cities than major cities, because in major cities there are a lot of competitors. So there are many guys who are already established in pain. So if you can go to a B-type city and start working on pain services, if you develop contacts with the orthopedic surgeons, spine surgeons, and other specialty surgeons, you will not have competition, and you'll click easier in B-type cities. So that is my suggestion for one person who has put a comment in one of the videos. So this is about what next after anesthesia. I think these are the different branches I feel you should know. And coming to the financial aspect, I told I would cover in the end. So coming to the financial aspect, super speciality and doing DM, any DM you do, cardiac, neuro, pediatric, onco, whatever DM you take, your salary structure, pay scale in a corporate hospital would be higher than MD. There is no rocket science in that. You can understand, you will get more money than regular MDs. So your starting salary would be high, and after that, to grow in that particular specialty or super specialty or subspecialty, whatever you call, depends on the centers. Several factors will come into the play there. So it depends on the personality of the particular person, and the revenue generated in that particular department. There are so many factors which come into the play. Even though you come under the service provision sector, the management would see how much revenue is being generated in that particular. There are several factors which come into the play, but the starting salaries would be more than MD anesthesia guys. So that aspect already I covered in the salary of anesthesiologists. So that's about what next after anesthesia. Hope you like this video, and if you want more videos like this, then please subscribe to the channel and comment in the comment section. I'll do more videos like this. Roger that.